is Dr. Jeff Ullery with my trusty assistant, Miss Judy. We're going to go over how to do a PNF stretch of the calves or the gastroc muscle, gastrocnemius. And this is a really important one for runners and anybody who's having plantar fasciitis, heel pain, anything going on in the lower leg. And so it's a super easy stretch that you can do really quickly. Just as a review, PNF stands for proprioceptive neurofacilitation. That's why we call it PNF. It's just super easy to say PNF. It's a dynamic stretch where you stretch, followed by a contraction, and then followed by a repeated stretch. It's the most efficient, most effective stretch that I've found, and that the research is pretty proves that. And so the old kind of stretches that we used to do where you stretch and hold and try to hold it for 30 seconds, really not very effective. The research on that shows that you got to hold those old stretches for a minimum of 8 minutes, which I'm not going to do. I'm not going to ask my patients to do. And so anyway, so what we want to do is we want to have Judy go ahead and stand up. And Judy, if you would, you're going to just put your hands on either side of the door here, the window. And you, if you would, back up, and you want to pick one. You can stretch both of these at the same time. I tend to try to isolate or recommend that you isolate. And so why don't you bring one foot forward, and then you're going to want to back your left foot up a little bit more. Let me get this out of the way. There we go. Okay, one of the things that you want to make sure you do is you want to make sure your foot is lined up perpendicular to the hands. You want to avoid stretching it like this. You can stretch like that a little bit if you wanted to isolate specific areas, but I want to make sure that we just hit the whole calf. Okay, now the back part of the calf is called the gastrocnemius. Just below those two big muscles, we have a muscle called the soleus, and you can do something to get in deeper to get that soleus if you need to. But starting out, what we're going to do, if you would, Judy, is just bend that front knee, keeping that leg super straight, and then move forward until you feel that tension in the calf. And are you able to feel that? You had to bring it back a little bit?
Yeah.
Okay. So she had to bring her foot back a little bit because she's got some pretty good flexibility in the calf. But she wants to bring it. One of the things you want to make sure you do is keep that heel in contact with the floor. Okay? And so you want to just hold and stretch. There shouldn't be any stress in your shoulders. There shouldn't be any stress in your back. You should just feel all that stretch in the calf here. And you want to hold it for 10 seconds. All stretches we want to hold for a 10 count. At the end of that 10 count, what you want to do, Jude, is you want to actually go ahead and relax a little bit and then pop up onto your ball of your foot and you're basically contracting your calf muscles. And you want to hold that for a 3 count. And at the end of the 3 count, go ahead and drop your heel back onto the floor. All right, and then go ahead and move back into the stretch, remembering that all muscles are a bundle of fibers, they're a bundle of rubber bands, and you're really trying to stretch the tight ones, the tight fibers. You're not trying to just go as deep and as hard as you can. You're really trying to isolate any tension you feel. So as soon as you feel tension, you stop and stretch. All right, and then let's go ahead, that's about 10 seconds. Go ahead and pop back up onto the toes. And she's going to do that for 3, and then relax it and come back down, and then go ahead into that stretch one more time, and you'll feel that you get a little bit more out of it every time, right? Mm-hmm. And so she did a really good job on stretching the calf. Some people are going to be a lot more tense and tight, and so they won't be able to go as far as Judy's able to go. Let me show a variation of this, a couple variations. One of the things you can do, if it feels like you have good flexibility here, but you're still feeling tight in the calf, you can bend the knee slightly and then go into it, and what will happen is go ahead and bend that knee a little bit more. You feel how much deeper that goes. It goes really deep, and that's part of this. That's the soleus stretch. That's the deeper muscle underneath the calf muscles or the gastroc muscles. And so that's one way you can isolate and change. Another way you can do it, if you want, is if you don't have as much room for some reason, or you just want to isolate a little bit more, go ahead and bring that foot up. And then what you can do is put the ball of your foot on this block. So if you were doing a curve, a lot of people will stretch their calf on a curve. What I want to show you is the thing that people do incorrectly. Can you go ahead and, what would you do if you were stretching this calf? So can we do your right foot?
Mm-hmm.
Yeah. Thank you. Judy's doing it perfectly, but a lot of people, what they'll do is when they try to stretch it, can you lift for a second?
Mm-hmm.
They'll have their foot like this, and when they do the stretch, they leave their heel hanging in space. And when they do that, if you leave that heel hanging in space, there's no way that calf is going to let go. Okay, so make sure if you put your foot on a curb or a surface where you're trying to get a little deeper into that calf, this is a really good variation if you're super flexible, but you really want to get more stretching. You do the same exact movement. So you're going to stretch it for how long, Judy? 10 seconds, right?
Mm-hmm.
And then at the end of the 10 seconds, you would just take that heel off the ground and put pressure on that. Just carry your weight. There you go for 3 seconds. And then you'd relax it and then come drop back down and get that heel. And again, just like the other stretch, you're going to move forward a little bit, but you can feel how much deeper you got just between the first and second time. So that's the calf stretch or the gastroc stretch. It's a really good stretch, especially for runners. We have a fascial band that goes all the way down the back of the leg, underneath the foot. This is a very good stretch for somebody who's dealing with plantar fasciitis. So appreciate you joining us.